Okay, so we are live. Mr. Hussam, the mic is yours to introduce the third session of the day. Thank you.
Thank you, Dr. Walid, and welcome back to all our attendees. So now for the third session of the day, the one before the last, and it has two main presentations. So the first one will be presented by Dr. Ahmed Abbas, and Dr. Ahmed is actually has a long experience with in anesthesia and critical care. He is a consultant and currently he's working as senior registrar in one of the prestigious Irish hospital. He did many qualification and especially in pain management, which is his special interest. He has excellent experience in getting interviews in different Irish hospitals for various registrar and fellow posts. So I hope you will get the most out of him, and please feel free to put your questions in question and answers. Thank you, and mic with you, Dr. Ahmed.
Thank you for your nice introduction. So in the beginning, I would like to thank Dr. Walid Al-Habashi for his kind invitation to this event. And I would like also to thank the British Egyptian Doctor Association for this kind invitation and also for their effort and their dedicated time and effort to help our international colleagues who likes to come either to the UK or Ireland or whatever, something which could be a good step in enhancing your qualification and experience as well. So today we're going to speak about the clinical audit, and the problem is in most of our Arab area or Middle East, audit is not part of our routine practice, and not a lot of people are aware and involved and engaged in quality in general and the clinical audit in particular. So where to start? This is always the question of everybody who likes to improve his CV so he will be able to compete with other colleagues when he is applying for his first job to the UK or Ireland. So what to expect from my lecture? I will just take you through briefly about the importance of audit, why it's important, why it's something you need to consider in your CV or in your practice, and how to conduct an audit, and how to write an audit report, and how to answer the audit related questions in your interview. Of course, this is a wide topic, but we'll try as much as we can to cover and just give you the first push in your first audit, or if you have done audits before, how to try to publish it or present it in any event, so it will add more value to your, or more credit to your CV. So starting with the first question, why the audit is important? What is the importance of the audit? So to answer this question, we need to, 1 second here, sorry. Yeah, we need to introduce you to a term you might not come across before in any other system or in some other systems in Middle East, which is clinical governance. So clinical governance, simply the hospital treating patient, and this kind of treatment should be according to guidelines and protocols which is known to the medical system. So the hospital are required to ensure the quality of this service, and the way they are ensuring the quality of the system through what's called the 7 pillars of the clinical governance, which is clinical effectiveness and research. So some big hospital are involved in the research because somebody needs to do that, and audit, which is the second important pillar of the clinical governance, risk management, education and training. Improve the staffing and the quality of the staff, and keep the good staff inside the hospital and encourage them to stay, improve the information of the patient and introduce information technology, and also cross-bridge with the community and involve the public in the in the patient's care. So as we can see, audit is one of these pillars. We're not going to speak about the other 7, and there is another lecture for that, but today we are going to speak about audit alone. So what is audit? Simply, there is guidelines to regulate and enhance the quality of the medical service given to the patients. And these guidelines is just a piece of paper unless you will apply it in your practice. So when we are in conflict about one aspect of the practice of patient with other department or other colleague, because we know that there is guideline to be applied here and the hospital doesn't apply it, and persons in the hospital doesn't recognize this kind of guidelines. So we have 2 ways, either to fight or to apply audit. So audit simply is a systemic examination of current practice and assesses against your institution performance to see if there is any match between them. Is this different from research? Yes, absolutely. It's different from research. So research is investigating new ways or new drug or existing drug in another way. So simply the research doesn't check either you are complying with something or not. You conduct research to find new answer for an old question or new arising questions, and it helps building the guidelines. So the research gives us the evidence that help us to guidelines. Then the audit is the process of comparing these guidelines to what we are doing. So it's absolutely different from each other. Research is help establishing best practice, while audit check the best practice is being applied or not. So this is the importance of the audit. Audit is very important in the hospital, important for you, because any hospital to hire you, they need to make sure that you are not only the person who can give the medical care for the patient, but also the person who will help the hospital to improve the quality of the service they are providing to the patient. And this is through a lot of things, including the audit. And let me tell you that the audit is the most easy way to show them that you have interest in clinical governance and in quality improvement. So how to start? Some hospitals have quality departments that are involved in organizing audit, and some consultants in every hospital are really interested in audit everywhere. So what you can do is to go to one of these consultants and ask his help. I need to organize an audit, how to start it here in this hospital, how to register it in this hospital. This is kind of logistic things you need to find out about your hospital. But in general, we have, from my point of view, there is so many ways to explain how the process of audit goes, but this is my favorite one. I divide it in 6 steps. Step 1 is to identify a problem or issue in your health organization. Then you need to find if there is any standards available, like guidelines, like protocols in the national level or in even international events, that can improve this aspect of patient care or not. Then you need to start to collect data about your current practice, and we will say how, and then try to assess your current practice against these guidelines and see if they are matching. Then start to implement this change and reassess again. So we'll start with step 1, which is identification of an issue. So simply, we divide these issues in some categories. We can say this issue is high risk or high volume or high cost, for example. So high risk means if it will happen, patient will be really harmed or staff will be really hard. So we don't like this to happen. Also, volume means it's a recurrent issue. It happens all the time and to a big group of patients, and we need to let that stop. Or cost, we'll say this is a high cost issue. It means it costs the hospital a lot of resources of the hospital is going in vain. So we need to stop that. So simply your job is to watch your hospital practice or your colleague practice, and you start to go for the next step. which is identify the standard. So if the hospital have standard, for example, protocol for the treatment of the DKA, and you think that people are not following that, or hand hygiene protocols like moments of 5 moments of hand wash or whatever, and you think people are not really abiding to this clinical guidance. So you need to find an evidence or a supported guidelines. If the hospital have, that's fine. If the hospital doesn't have, you find in the national level, like you find the Ministry of Health in your country, they have guidelines for this kind of practice, and it's not applied in your hospital. So find the practice and find the standard. Then you try to assess what's happening in your hospital. For example, if we will say about patients in the perioperative period should be assessed for anemia for major surgery, then you notice some people comes to the surgical day ward or to the operation theater, and you found that their hemoglobin is low, for example. So you need to ask, how frequent is this problem? We need to collect data to know if this is a real problem or it is just like a single error or something which doesn't happen frequently. In order to know that, you need to collect data. And this data, you need to collect it from, for example, medical record or your personal observation. And then you need to put this data in when you are proposing for the audit, you will say, I will collect the data for 1 or 2 months, and those patient category, I will collect the data about major surgery, for example, and we will do that for some excluded population and included population. Like I will include every patient who comes for major surgery, for example, neurosurgery, because you notice that the neurosurgery are not checking the hemoglobin of the patient pre-op or something like that. So you define your time and define your included population fairly from the beginning before starting to collect the data. Then when you collect the data, you start to analyze it. When you analyze the data, you will say, okay, we are doing that and that and that, and this is against the protocol, and this happened in how many, or what is the percentage of this happening, like 50% or 60% of the patient having this problem. So, okay, so we have real problem here. We are not following the protocol. The step after that is to implement changes. So here is the most difficult part. You were able to identify a problem happening in your hospital, and there is a protocol that can solve this problem, but we are not following the protocol. So what is your suggestion? And this is the importance of sitting with your consultant and having guidance from consultant, because he knows better. He can, as a junior doctor or a middle grade doctor, sometimes you will not be able to find solves alone. So find your consultant, talk to him, what we can suggest here. So changes can happen through, for example, altering protocol. Like we have a protocol, but this protocol doesn't work well. The consultant will give you the power to do that, because he's a consultant, so he can help you changing this protocol or initiating the protocol if it was not existing. Also, the solve could be like, we need to implement more training for our staff. Our staff are not trained to do good hand washing. For example, you applied, so you checked your hand hygiene practice in your hospital, and you found that hospital doesn't know how to wash their hands. So the solve could be to start to teach the healthcare staff how to do hand hygiene, or raising the awareness to the guidelines. For example, do lectures to the people who are involved in this practice. For example, we noticed that the Department of Anesthesia are involved in this kind of repetitive practice, which causes the hospital a lot. So we need to do a lecture for the anesthesia department, talk to them, convince them that this is our practice and this is our guidelines, and we need to get closer to each other. Also, we can, for example, improve documentation. Like, for example, when they started to notice a lot of wrong side surgery, the WHO initiated kind of a checklist that every hospital use now to do sign-in or surgical pause before starting the surgery. and to make sure that this is a correct patient, this is a correct procedure, everything is in place and working well, and everything is ready to go. So this is kind of improving documentation, which solve a very big and repetitive problem. Also, it could be like we need to check the temperature of the patient. We notice that some patient comes to the operation theater with high temperature, and they could have COVID and untested before coming. So we need, for example, to check the temperature. So we need to change the equipment, find something that can be easily implemented and help the staff to comply with hospital guidelines of checking the temperature of the patient coming inside the theater. So this is example of the changes that we could suggest, and you could ask the help of your consultant and head of the department to help you to apply this. If you will stop at this level, that's good, but it's not perfect. So the perfect thing is if you apply changes, you need to assess if these changes has improved the system, because you recognized some problem and you solved this problem, then you could find that the standard, the practice that we are trying to audit didn't change. So that means there could be another problem. We didn't find it. We need to find that problem and give suggestion to solve it, and then re-audit again. So you need to repeat the audit again using the same sampling criteria that you used before, and the same tool and the same analysis, and see if there is an improvement in the performance, or still the same, or it became worse. So you need to find another solve, and so on. So this is the next step. So the dust should be allowed to settle. Everything that like if your changes has been effective and meaningful, like the document you suggested is being now added to the chart of the patient and everybody is doing it. This is the solve we suggested, and then let's re-audit. So the re-audit is commonly referred as to closing the loop. Which loop? This will take us to the next slide. So this is how a lot of people also likes to describe audit. It's a continuous process of improvement, which is starting by planning an audit and following a standard to improve, then measure your performance and compare it to that standard, and then make an improvement. But you need to sustain this improvement later on by re-auditing. Like you will suggest, like after 6 months, I will re-audit again. After implementing this measure, we will re-audit again. And this is what we call the cycle of quality. Okay, so this is how to conduct an audit. Now, after you finished your audit, it will add more credit to your audit if you publish it somewhere, or if you present it in some local or international conferences. So you need to learn how to write an audit report, because if you have quality department, also you need to submit this audit report to them, so they will help you also implementing your changes. Also, if you learn how to write an audit report, you can take part of it and submit it as abstract in any conference, because in conference they will have guidelines. We need our abstracts to be like that. They will provide you with templates, so you can take from it and put in the template of the abstract and make it as poster presentation later on. But regarding the audit report, there is some elements which is like good for audit report, or some criteria which could be covered or should be covered in an audit report. Starting with the title, it should be no more than one sentence. It should clearly and concisely state the focus of the audit. Like, for example, audit to check the compliance of the staff to blah, blah, blah in this hospital. So this is the title. Only one sentence. It gives me idea what is this audit. Could also include the population of the patient, like in children or in pregnant ladies. So it's something that could attract people to read your audit, and it comes by practice, to be honest. Then the next thing is the background. So briefly describe the reason for undertaking this clinical audit. For example, evidence of potential quality problem, or recent clinical incident. Like you said, in our hospital, we noticed that there is a recurrent incident, which is so and so and so, or let me, if it is a re-audit, tell me that it's from previous audit. We had recommendation or action plan, and we applied this action plan and we plan to re-audit after 6 months. So this is the background. Or you can tell me this audit is required to ensure adherence to new clinical guidelines following their implementation, for example. So the background gives me idea why this audit needs to be done. Then moving to the next one is the aim and the objective. So the aim, simply state what you expect the audit to achieve. So for example, the aim should specify clear improvement focused goal. For example, it always starts with to ensure, to improve, to whatever, something like that. So for example, you say to ensure that a particular practice is safe, or to ensure that a recent change in practice has improved compliance with like evidence-based standard or whatever. Or for example, if you are going to the UK and you want to do measure the your hospital performance against a NICE guideline, so you can say to ensure the practice is compliant with NICE guidelines. And the objective is to identify how you will conduct the audit project to address the aim. And there is a way to write the objective, which we call the SMART technique, which is like your objective should be specific, measurable, achievable, realistic, and timely defined. So this is specific, measurable, achievable, realistic, and timely. This makes the word or the letters of the word SMART. So your objective should be SMART. And then talk to me about the standards in your report. What standard and guideline have you compared practice with? And what criteria have been used? Specify the full title, reference, and source. And for example, NICE guidelines, Royal College of Anesthesia guidelines. And I'm talking about anesthesia a lot because I'm an anesthesiologist. So you can say AAGBI guidelines. So refer to it clearly and don't let the reader go to the guidelines to understand what you mean. Just give him brief about the standard from these guidelines which you are auditing. And then describe your method, how you collected your data. It's really important. Have you done that retrospectively or prospectively? Have you collected it from medical record or direct observation? Have you asked for example, surveys from your colleague? This is all need to be stated in your methodology part of the clinical audit report. And then you need to give me the results and conclusion. What you found in your results and what's your conclusion, what you think the problem is, and then go to the recommendation and describe any suggestion for improvement, and then finalize it by an action plan. So make an action plan from the recommendation you have recommended, who is responsible to do that, who will be entitled to follow up. And it's better if you will give also plan for re-audit. Like we will apply that, then after 6 months, we will re-audit again and check if we achieve the target or not. This is about the audit report. Those are the 8 items: title, background, aim and objective, standard, method, results and conclusion, recommendations, and action plan. A lot of audit report can vary. Your hospital may have a template for an audit report if you want to follow it. So this is how to report an audit in general. Then to the last thing, how to answer the audit related questions in the interview. So let's be clear about that. You are making an audit to improve the quality in your hospital, but also to add some value to your CV. So you should be able, like your CV will take you to the interview, but how you answer the questions in the interview will give you the job. And everybody knows that the jobs in the UK now became really very, very competitive. And it's not enough that you have done a lot of these surgeries or anesthetized of those patients and blah, blah, that to the end of the list of the kinds that you can show in the CV, because a lot of doctors are already like you. So you need to think about, I will show my audit, my work and quality to show the hospital that I am the best candidate to fit it in this position, because I will help them not only to care about patients, but only to improve their quality. So after putting this audit in your CV and mention if you have done presentation or whatever, you need also to answer the question in the interview. So the most common question is he will pick an audit from your CV and ask you about it, or ask you in general to choose, tell us about an interesting audit that you have done. And here, remember something, which could be interesting to you might not be interesting for him. So you need to choose something based on the interviewer. So it's better, of course, to ask who is going to interview you. And if you can ask somebody in the hospital, what is his special interest? Okay, so he is interested in obstetric anesthesia. Okay, and I have done an obstetric anesthesia audit. So when he is asking me, maybe I didn't enjoy that audit a lot, but it would be smart to tell him that you have enjoyed it, and this is the one you are going to present, because this will catch his attention. But how to answer this question? You need to follow a method to answer this question. So you need to arrange your ideas. Don't shovel around and try to bring a word from here and word from there. This is not going to help. Always fix your mind to a way that you will answer this question through it, and try to train yourself, rehearse, and until you master it. So start with simply why this audit was necessary. So you will tell him, in our hospital, we noticed that we have this wrong practice or this recurrent issue, and this is not matching with, this comes to the next step, the standard use. This is not matched with the NICE guidelines, or it could be improved using NICE guidelines. So we decided to do the audit, and you go to the next step. What was the results of the audit? We found that a lot of staff are doing blah, 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 or a lot of patients are having issue with blah, blah, blah. So we found the results that tells us there is a problem. What was your proposal of changes? So we initiated an action plan. We started lectures. We started a form to be put in the patient file, or we put posters everywhere, or we conducted teaching for the staff. And the most important of here is, this is your audit, but what about you? The interview is about you. It's not about your audit. You are not marketing your audit. You are marketing yourself. You are selling yourself. So you need to let me know, what was your role? Are you the one who picked up the problem? Are you the one who collected the data? Are you the one who did the analysis? Have you a team with you? Did you involve any other departments with you? So you need to be clear to me, what is your role in this audit? And then re-auditing is really important. So have you done a re-audit? If you moved from the hospital before the time of the re-audit, it would be nice to tell your interviewer, like, okay, so we had a plan for re-auditing, but I left the hospital and I left it with the team, and I followed up later on with them, and they told me that they have done like blah, 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 blah. So give him an idea that you really understand what is the cycle of the audit and the value of re-auditing. And the last one, but not the least, if you presented that one somewhere, it's really, really, really important that you show that in your CV and your interview, because you are publishing something, or you are speaking to people in national or international conference. That's more value to your CV and your application for the job. And the last thing, again, which we highlighted in the beginning, you need to, nobody will ask you what is the difference between audit and research, but you need to be clear about your audit, that it's an audit. What you are doing is measuring practice against a standard, not you are making a standard. You are not checking the response of the patient to this antiemetic or this antihypertensive. This is a research question. Stay away from research questions. Take guidelines or standards and check if you are applying it. This was a brief idea about the audit and how to start. And even if you are in a hospital which the quality department is not conducting audit, or are not clear about what audit is, you can ask the help of a consultant and go to him, suggest something, and go to them, ask them, I want to register this audit, and try to do it, and then publish your results or present it in any conference. This is how you can start. And as I said, this is so brief, and you will find a lot of questions that will come to your mind when you start. So it's really important to refer to, there is a lot of guidelines available from, for example, this is from Ireland, and this is from the UK. Again, this is from Ireland, and this one is very nice. It's from UK as well. It's all guidelines how to conduct clinical audits, how to start. A lot of answers to your questions that I'm sure it's in your mind now. You might find it if you furtherly read those papers. If you are an anesthetist, the Royal College of Anesthesiologists has gone the extra miles. They made an audit recipe for the anesthesia trainee that you can even pick the title of your audit from there, and they give you what is the standard you can use to measure this protocol. The problem is just the book is from 2012, so a lot of guidelines has changed later on, but it could give you an idea how to do an audit as well. Thank you for your time, and thank you the panel for inviting me, and back to the panelist.
Thank you, Dr. Ahmed. That was very comprehensive. I personally learned from it.
Thank you.
Even if I did all these audits before, but yeah, that was very comprehensive and reassuring, actually, that it is very structured approach to it. So actually, I will hand over again to you for to introduce one of my favorite senior colleagues, Dr. Ablati. So I will give you this honor this time, but next time I will introduce him. Okay, please go ahead.
Thank you for giving me this honor to introduce Dr. Abdelati.